questions first that people have to make sure those are cleared up. And then if everyone gets tired of answering questions, then I will go ahead and either ask you questions, or I will go ahead and do that. And as I do that, I'll try to review all the stuff that I think you need to know. Okay? Some of the highlights, so you don't have time to cover everything.
Of course not. College kids.
And, well, I was just thinking if we ran out of things that you could just finish those few PowerPoints you didn't do, but it doesn't, whatever everybody else wants.
Yeah, this is another choice too. So is there any particular part of the last couple chapters that you feel more uncomfortable with? Or more
nervous system.
Yeah. The whole chapter.
The whole nervous system.
So are you specifically talking about the autonomic nervous system?
Yeah. Like, all of like the receptors and the little parts that it has, and
Okay. Well, there is a lot to that, right? It's not really all that bad when you try to break it down to its most basic parts. So let me try and draw a picture of this again. We don't happen to have a large piece of blank paper I can have? All right. So, really what you might want to think about first is, what's the function of the autonomic nervous system? What does it do?
To maintain homeostasis?
It maintains homeostasis, right? That's the basic thing, right? Then you might also want to think about what is it that it controls?
Parasympathetic and sympathetic.
So those are the two branches, right? So what it controls is more like asking what is the effector?
Involuntary movement.
Glands and the
Yes.
smooth muscle
So
and
glands and
cardiac
smooth
muscle.
Yes.
and cardiac muscle, right? And that's the opposite of another branch of the nervous system, which was the somatic branch, right? So autonomic and somatic. And the somatic controls skeletal muscle, autonomic controls smooth muscle, cardiac muscle, and then glands. And that could be both exocrine and endocrine, right? All right. So we have that. And then you should also realize that the autonomic nervous system is a branch of the efferent division of the peripheral nervous system, right? At least most of it. And then, it's okay. And then you might want to think about, well, how does it differ in terms of structure from the somatic nervous system? And there's one big thing there. That would be...
Is it that one motor neuron that, like, for the somatic, just one
The
motor neuron going
postgangliotic.
to skeletal muscle?
Right.
And then with the autonomic, it's two motor neurons.
There you go. So somatic nervous system, we have a one neuron pathway, one efferent or one motor neuron pathway to the skeletal muscle. With autonomic, it's always two, right? And then the first one was called the
Pre.
You're right. I got it turned wrong. The preganglionic neuron, and the second one was called the postganglionic neuron, right? So we have that. And then, let's see here. What are some differences, some other differences amongst the sympathetic and the parasympathetic brain? Now,
The sympathetic has that
Butterfly.
chain, that ganglionic chain. The sympathetic.
What is the name of that ganglionic chain?
oh no.
Oh, you have another thing? Okay.
Sympathetic ganglionic chain? No.
See, you said it was what branch?
The
Sympathetic.
sympathetic.
Sympathetic, and it's a chain, so it's a sympathetic chain ganglia, right?
Okay.
Or the paravertebral ganglia, because it's right next to the
Okay.
vertebral column. So what's in that particular structure?
Has,
Someone says soma? So, what's soma? Did someone say soma, or did
What are you looking at? Are you looking
I
at
think
this?
they did?
I was just doing my memory, but yeah, that's what I was talking about. Yeah, it's got soma. Doesn't
What's
it?
soma?
It's got
What soma are located in the...
neuron.
Thoracolumbar.
Well, it is the neuronal soma, right? But what neuron is there? What neuron cell body is located
Is it the ganglia?
Vertebral chain.
What is a ganglion?
Oh, what is the?
Collection of
Collection of neurons
in the
nucleus.
peripheral.
Okay,
Yes.
so
So
this
this
would
is a
be
chain of ganglia.
ganglia.
What neurons are there? What neurons have their soma there?
Thoracic and lumbar.
No? Okay, so we're talking about this autonomic nervous system, right? And you just told me it's a 2-neuron pathway.
The
the
pre-ganglionic,
And post.
the pre,
It's the postganglionic neurons that have their cell bodies in the paravertebral ganglia. Postganglionic neurons of the sympathetic brain. Now, some of you were trying to tell me it was the preganglionic neurons, but where are their cell bodies?
Aren't they in the
Right
central nervous
next.
system?
They're in the central nervous system, and where?
In these.
spinal.
It's in the spinal cord for the sympathetic, but where?
Oh, isn't it in the?
Huh?
Thoracic and lumbar.
It's going to be in the gray matter, and it's in the thoracic and lumbar areas of the spinal cord, right? Okay, so we had that. So those paravertebral chain ganglia, they were really close to the spinal cord, right? So what does that mean is true about the length of the pre and postganglionic neurons?
The
axons for
pre
sympathetic?
is short
Pre is short,
and post is long.
post is long. Okay, then you might want to think about there are some other things that were a little specific to the sympathetic, and it really
It's fight or flight.
no, that's
Yeah.
not what I was going to talk about. It was really more about how we can describe how the preganglionic neuron synapses with the postganglionic neuron.
Synapses with a lot of them at one
Yeah.
time.
Okay, so one preganglionic neuron synapses with lots of postganglionic neurons. Why should you care? You were going to say something, right, Francisca? Oh, that's okay. I like laughing. Okay.
Maybe because the nerve wants to reach more than one part of the body.
So that's really important, right? Since we're synapsing on multiple postganglionic neurons, that means that those postganglionic neurons go to a wider area of the body, right? How did we describe that kind of effect? Instead of localized, it was...
Oh.
Spread out.
That's not the word.
Generalized? I don't know.
No.
Diffused,
It's-
right?
Yeah, diffuse, definitely, that's the word.
So then we have that with the sympathetic. But isn't there another case of the sympathetic where things are a little bit different too? From the parasympathetic?
Well, what it releases.
Okay, I'm thinking more about structure still.
Structure.
So normally we have a 2-neuron pathway, but wasn't there one thing that was different with the sympathetic?
Heart.
Huh? No, that's not the thing that's really different with
The-
the sympathetic.
Is it the heart?
No. So,
The post ones are long? No. Yeah.
well, that is true, but we've already talked about that. So, normally the postganglionic neurons release what neurotransmitter?
Oh, the sympathetic.
Of the
Is it?
sympathetic. We're just talking about sympathetic.
It's the
Norepinephrine.
Norepinephrine, right? Normally they release norepinephrine. But why do we talk about epinephrine all the time?
The
The adrenal what?
medulla.
Medulla, right? So with the sympathetic nervous system, we normally have that 2-neuron pathway, but we also have the preganglionic neuron going to the adrenal medulla, and the adrenal medulla is releasing epinephrine that acts. How is it acting? It's not a neurotransmitter, right?
And it just goes into the blood vessel.
So it's a hormone, right? Because it goes into the blood. So the sympathetic nervous system also turns on the release of epinephrine
Is-
from the adrenal medulla.
Is it like it's doing two different things? Or no, everything goes through the
It's all simultaneous.
adrenal medulla?
Right, so we have direct neural connection to an effector, but then we also have.
Okay,
the
it's all
adrenal
going on at the
medulla.
same time. Okay, but there's two different things going on at the same time. That's
So
what
it's
you're
two
saying.
different ways of activating the same effector.
Okay, okay.
Right? And remember that when it's activating the adrenal medulla, we're really looking at neural control of hormone release. Because remember, when we talked about hormone release in the last chapter, we talked about humoral regulation, we talked about neural regulation, and we talked about hormonal regulation as well, right? So sympathetic nervous system is an example of neural regulation of a hormone, which is epinephrine. All right?
So does that mean that the epinephrine comes in a hormone type way and through neurons as well?
That's right. That's right. Okay? And because it's released as a hormone, that's another reason why you get diffuse effects, right? Because the hormone goes everywhere, right? But then also, when you release it as a hormone, you're going to have to put a lot more of it into the blood than you would if you just released it across the synapse, right? So it's going to take a lot longer to get rid of all the epinephrine than it would to get rid of, say, a little bit of norepinephrine at a synapse. Okay? Okay, so that's a little bit about sympathetic, but then how does the parasympathetic differ?
Well,
The preganglionic neurons are located in the craniosacral.
Okay, so preganglionic neurons are in the cranium, or the brain.
and they're also longer.
Spinal cord.
The
preganglionic ones are going to be longer. That means the postganglionic are going to be
shorter.
Okay, so we have that
It's
kind of thing.
synapses with only a few other postganglionic.
A few postganglionics, right.
Rather than a bunch.
So you get more
Localized.
Right. Okay, so those are some of the higher order differences. Let's talk about the thing that you mentioned at the beginning, neurotransmitters and receptors. So, sympathetic preganglionic neuron. What does it release?
Acetylcholine.
Acetylcholine. Parasympathetic preganglionic?
Acetylcholine.
Acetylcholine. And then, what kind of receptor do you have on the postganglionic neuron?
Nicotinic.
Nicotinic. Oh,
On which
I need
one?
to know that.
Nicotinic what?
What?
What was
Are
the
we still talking about
neurotransmitter again?
sympathetic?
Acetylcholine.
Acetylcholine. So it's going to be a cholinergic fiber, and the receptor is a cholinergic receptor. So it's really a nicotinic cholinergic receptor. Okay? Because
I'm not gonna remember that.
acetylcholine. Okay?
Did you say that again?
That's a particular type of acetylcholine receptor. It's one, well, that's a good question for everyone else. Why do we call it nicotine?
Because it's excitatory?
Not just because it's excitatory, although that is true of the nicotinic ones. They're always excitatory. Why do we call it nicotine?
Because
Some old guy decided that.
nicotine is what
And he died, and
excites
we have
it. Because nicotine is what excites it?
Because nicotine is an agonist of acetylcholine on this receptor, right? So nicotine does the same thing as acetylcholine if you give it to that particular receptor. Okay, so that's why it's called nicotinic. Oh, and then there was an antagonist for it too.
Curare? Or it's not, I don't know how to say it, but it's
Curare.
Curare. Yeah.
Good try. Good try.
Curare blocks nicotinic cholinergic receptor. Okay? Alright, so you said
Ooh,
that
me.
nicotinic cholinergic receptors are always excitatory, right?
Right.
Why? Now, why do you say it, but why are they always excitatory?
I have no idea.
Because they're not inhibitory, right?
Where else did we see nicotinic cholinergic receptors?
At
We see them
Well, they're
in the
gonna be-
parasympathetic division and the
We saw them on the
postganglionic.
motor end plate, right, of the neuromuscular junction. How did they work?
well, it causes a
Ion channels open.
Which ones?
sodium.
Sodium. So sodium ion channel is open. It's basically a sodium ion channel, right? So we stimulate this thing, the ion channel's open. What happens?
Sodium goes into the cell.
Sodium goes in, so
It
the
causes
cell
a
depolarizes. So is sodium ever going to go out of the cell?
No.
No.
No, 'cause it's always.
So that means that it is always going to be excitatory. Alright? So, sympathetic side again, the postganglionic neuron, what is the neurotransmitter that it releases?
Norepinephrine. Oh,
Norepinephrine.
can't say
Unless
that.
we're talking about the adrenal medulla, right?
Yes.
Postganglionic neuron, what neurotransmitter does it release? Okay, so what can you tell me about the receptors?
You have alpha and beta that are on the
Okay, alpha and beta what?
adrenergic.
Adrenergic receptors, okay. What else can you tell me?
Well, alpha is always excitatory, and beta,
Beta is
it's
both.
usually inhibitory. It's at B1 and B3.
Okay, so where would we find it, B1 and B3?
In the
In
heart.
the heart for B1 and in adipose tissue for B3.
Excellent, okay. So B1 is beta, right? And B is alpha. All right, excellent. So, parasympathetic, postganglionic neuron, what is it?
Acetylcholine.
It is acetylcholine as well, right? What's the receptor on the effector?
Muscarinic,
Muscarinic.
Oh,
Muscarinic what?
cholinergic.
cholinergic.
Right? Muscarinic cholinergic. Not muscarinic adrenergic, right? Muscarinic cholinergic.
So adrenergic. I can't say the words. Adrenergic.
Can you say wait? Can you say adrenaline?
Maybe.
Right.
Adrenaline.
See, no problem, right? So just say adren and then say urgent.
Adrenergic.
There you see, no problem.
Okay, so that's only for norepinephrine.
And epinephrine, right?
Yeah, well, yeah, those are always
That's right.
paired together. But and cholinergic are always acetylcholine.
For acetylcholine. because
It
acetylcholine
like it
is-
never changes. There's no like
That's
other
the thing.
name.
Cholinergic.
Okay, I just want to make sure there's no like tricks.
It's kind of like it's a
I-
last
Tell
name.
us another name and you'll come up with a name on the test. I'm like,
Do you introduce brand new names on the test?
Do you ever make up names, like something, like a whole bunch of stuff that's not real in the test?
I've done that.
I probably picked it too.
Like, oh, this
Wow.
Some of the words like that.
Yeah, it depends. Some of the times he has me
But you
rolling.
know
I'm
what,
like, how is
it
it
doesn't
this?
make any difference what name I give for something else that's wrong, right? You know the answer, you're okay.
I memorized the first 5 letters of all the words.
That would be a bad thing to do.
Yeah.
What? That's confusing.
Okay.
Sorry.
And you see me do stuff like that in a IQ question, right?
Yes.
Throwing garbage things up there, kind of to make you laugh. You know what the real answer is, it would be funny, I guess. Anyway, so, track of where I was. So we were talking about muscarinic cholinergic receptors. We were talking about alpha and beta adrenergic receptors. Now, the next thing I would ask is, how would you describe the effects of the autonomic nervous system? Say sympathetic versus parasympathetic.
Well,
What would it do to particular,
it's going to
parts of your
increase
body?
or decrease heart rate.
Stimulate.
Which one?
Well,
It's gonna do what?
sympathetic is going to increase.
Increase heart rate?
Yeah,
Okay.
and
Parasympathetic
parasympathetic
would
will decrease.
decrease it. What other kinds of things do you think about?
Any type of other organ, it's probably going to affect it.
The digestive organ,
Pretty much.
What about the digestible?
the parasympathetic
Go
will
up.
increase it.
Increase what about it?
Its activation.
It'll make it,
It'll
the
be
muscles
using it,
will
contracting.
be
Track more
contracting.
frequently. So with parasympathetic, you're
'Cause
going
it's
to
rest and
basically
digest.
enhance digestion.
Yes.
So you
Enhance,
might
I
get
like
more digestive juice secretion, more enzyme secretion, and
What
things
about
like
bile?
that. What about blood flow?
Is this
Sympathetic is going to decrease.
Decrease where?
Pressure.
Sympathetic
Parasympathetic.
is going to cause less blood to flow to the digestive tract and more
Yes.
flow to,
Everywhere else.
the skeletal
but
muscle.
particularly
Yeah.
skeletal muscle.
And increased pressure.
Parasympathetic would do kind of the opposite, right?
Decrease.
So how do we describe, what kind of terminology do we use to describe that we have differing effects on a particular target organ when we activate sympathetic or parasympathetic?
Dual interact.
Dual innervation means that it is controlled by both, right? But what I'm talking about is different effects.
Oh.
So
Fine.
sympathetic increases heart rate, parasympathetic drops.
We
How
have
do we
little,
call it?
is that what
Antagonist.
Antagonistic
Okay.
innervation. So dual innervation, but it's usually antagonistic. Except for, where is it not antagonistic?
In the reproduction?
Yeah,
In
reproductive
reproduction, so what
system.
happens there?
They act together.
To do what? What does each do?
I'll let you take that one.
We're talking only about the autonomic nervous system, right? So parasympathetic and sympathetic. How are they involved with reproduction?
Oh, isn't it with the external, well, hold on, I had to I was going at first. I know it's something with the.
Okay, so let's think
I
about
know it. I'm just trying to
this.
say it.
So let's go from the male's perspective first, because it's more obvious maybe. So in a male, what happens through this active sex?
You were just talking
It's
about,
gonna have an erection.
wasn't the sympathetic?
Erection.
Started like when you're ejaculating or something?
So the sympathetic controls ejaculation, right? What did the parasympathetic do?
Blood flow.
It causes.
What about blood vessels?
It's increasing.
Not well, constriction where? There. So it actually causes dilation, vasodilation.
It's gonna be more blood.
Vessels
More
going
blood.
to the penis, and that made the penis become erect,
Erect.
right? So it's the parasympathetic that gives you the erection, and the sympathetic gives the ejaculation. Okay? So that's in men, right? What about women?
It makes the clitoris.
Same thing. So women ejaculate?
No.
The orgasm.
So which gives the orgasm?
The
Sympathetic. And what does the parasympathetic do?
causes clit.
What's that?
Blood flow still, right?
Blood flow, increases blood flow, but to where? The clitoris, that's right. Okay? All right, what can you tell me about, say, sympathetic tone? What is that?
It's when there's always a little contraction on,
So a little bit of activation of the sympathetic has a little bit of contraction of what?
okay, sympathetic
Muscles where?
muscles in the glands and the
Really
Parts.
muscles around what?
Which one are we
What
talking
was that?
muscles, smooth muscles around the organs.
Oh,
Yeah.
I thought you had answered. The question was,
Smooth muscles around the
so we had
organs.
sympathetic tone, and my original question was, what was that? And then they said contraction, and I said, what? And then they said
The heart.
muscles.
Heart.
And then I said, where?
Everywhere. The heart.
Skeletal muscle?
No, cardiac.
Smooth muscle and
Cardiac.
muscle.
It would
Cardiac.
be either cardiac
Or
or
smooth.
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 But it's
Smooth
not
sailing.
cardiac, right?
Smooth.
It's smooth.
Oh,
Where?
everywhere.
All the visceral organs. No.
Not around the
Blood
organs, right?
vessels.
Talking about like,
Blood vessels, you said it, right? So remember,
I said the wrong
sympathetic
thing
tone
3
is a partial
times.
constriction of smooth muscle around blood vessels. So basically, to increase blood pressure, we can increase activation of the sympathetic to get more vasoconstriction, and to drop blood pressure, we can reduce sympathetic activity to give you more vasodilation. Okay? That was the sympathetic tone we talked about. Now what about, there was a parasympathetic tone
Oh,
too,
okay.
right?
Yes.
It's gonna slow the heart rate.
It keeps the brakes on the resting heart rate, right? So if you want heart rate to go up, what do? Run. Yeah, that will do it too. But how does running make your heart rate go up?
Because you're increasing the amount of
No,
breath.
our autonomic nervous system, how is it going to respond to your desire to run away from this review session? Huh? That's part of it, but what was controlling the resting heart rate? What did you just tell me? The parasympathetic tone, right?
Yeah.
So if you're going to increase heart rate, you reduce activation of the parasympathetic. That lets the heart rates pick up right there. Then you're going to make it go up even higher by activating the sympathetic nervous system. And which receptor is it going to be using on the heart?
Oh, is it the beta receptor?
Which one?
One.
Beta 1.
Beta 1 adrenergic receptor, right?
Yeah.
Yes.
Okay.
Adrenergic.
All right. Does that make sense?
Yes.
All right. So I think, weren't you the one that asked me about the entire topic of autonomic nervous system? You feel more comfortable? Okay. All right. So, does anyone else have any additional questions about the autonomic nervous system right now?
I keep on getting confused about the vasoconstriction and vasodilation. Is that so? When I thought like with the blood vessels, does the sympathetic? I thought the sympathetic like dilates the blood vessels.
It depends.
Oh, okay.
Well, it depends on the location,
So,
doesn't
when
it?
do we activate the sympathetic nervous system?
Like when we're in some kind of like
Fight or flight.
activity or
Fight or
The
flight.
fight or flight,
Fight or
right?
Flight.
Okay. So we've already talked about when that happens, you don't want more blood going to the digestive tract, right? Where do you want more blood going to?
skeletal muscle.
Skeletal muscle, right? So blood vessels going to the digestive tract are going to undergo vasoconstriction.
Okay.
So what kind of receptor would that be?
It would be the
Is it going to be excitatory or inhibitory?
Inhibitory.
So excitatory and inhibitory. Inhibitory means they're not going to be responding. Excitatory means they respond, right? So in the excitatory ones, we're going to see a response that causes smooth muscle contraction. Remember, the smooth muscles go around the blood vessels, right? So if they are excited, then they contract and you get vasoconstriction. Which receptor would be doing that?
Alpha cell?
Alpha cell?
Alpha adrenergic.
Alpha adrenergic.
She got it.
Right. Okay, but then you said we want more blood to go to skeletal muscle, right? How would that work? We're still activating the sympathetic nervous system, right? We have these alpha adrenergic receptors being
gonna be-
activated around blood vessels
it's gonna
along the
be
digestive tract.
vasodilation.
You're going to get vasodilation. What kind of receptor?
Beta.
Beta, right? So the beta ones are inhibitory, so we're going to go ahead and put on the norepinephrine on them. They are going to hyperpolarize, right? That means that they relax and you get vasodilation of blood vessels going there. Okay?
I got it on tape.
But it's
I can listen to
clinically
it over and
important,
over.
so you
Yes,
can know,
yes,
right?
right.
Yes,
right.
of course, of course, of
Listen to
course.
it over and over.
All right. Anything else about that? Or should we switch into the endocrine chapter?
I love the endocrine system. Like, I like it. I'm excited.
That would be so unfair.
What?
Because you would finish a class and you think, it's like knowing the answer to the whole plot line of some big series before you watch it. It'd be
Okay,
so
moving
fast.
to so easy.
Huh?
Moving to so easy.
Yeah? Really? All of them are? I don't know. If I watch House of Cards, I don't see what...
That's not a movie, though.
House of Cards, huh?
It's not a movie.
It's like a long movie.
Yeah, like a week-long movie.
Or if I watch Game of Thrones, I would like to know what happened. But I've read all the books, so I already know what's going to happen anyway.
And then it's not accurate, so you get mad and not worry about it anyway.
I hate reading a book and then going to the movies like, that's not in the book.
Okay.
I'm glad you have time to read.
All right. So, anything else about Autonomic?
Not that I know of.
Okay. Are you good with that review, Autonomic? Okay. I just want to make sure. You don't seem to really like my kind of stuff.
I was just thinking, I don't know. I'll have to look this up.
Okay.
Like the spelling of the word.
Yeah. Okay. So, on to the endocrine system, right?
Yes.
So, what's the major endocrine gland in the body?
Pituitary.
So fast. Pituitary. Okay. We have two parts, right? What are they?
Anterior and posterior.
Anterior and posterior, also known as
Neurohypophysis.
Yeah, and
That
that's
is the
posterior.
posterior is neurohypophysis. Any other name?
Adrenohypophysis.
Or the
Nervosa.
posterior.
Paranervosa.
Oh.
Pars
Paranervosa.
nervosa.
Pars
Yeah, I'm not
nervosa.
Anterior is
Is adrenohypophysis.
adrenohypophysis.
Oh, yeah, Paris Decellus. I don't know how to say it.
Okay.
Pars distalis.
Back to posterior pituitary. Rewind.
Pars
Okay, posterior
distalis.
pituitary is also called pars nervosa, right?
Yes.
And the other name was
Neurohypophysis.
right? Why is it called that?
Because it's got a neural connection
Yeah.
to the brain.
What part of the brain?
The hypothalamus.
Hypothalamus. So up in the hypothalamus, we have particular nuclei that have cell bodies of neurons, and their axons extend down to the posterior pituitary, right? Okay. So before I talk more about the anterior pituitary, since we're on the posterior pituitary, why don't we just figure out what hormones is the posterior pituitary release?
Growth hormone.
Antidiuretic hormone and the oxytocin.
Antidiuretic
Oh,
hormone
man.
and oxytocin.
I'm at the
What
wrong-
would you like to talk about first?
Doesn't matter.
It doesn't matter.
You brought the names up.
Okay, I guess we can talk about oxytocin.
Oxytocin. Okay. So what does oxytocin do?
Well, it's gonna be
Contraction.
Brings the milk down.
Doesn't
Milk
it cause
let
So
down.
you
contraction?
mean it causes the release of hormone,
uterine,
right?
not urine.
That's
It
also
causes
called milk letdown,
contractions.
right? That's one thing that it does.
Uterine
What else does it?
contractions.
Uterine.
Uterine contractions.
Uterine contraction, so it's responsible for parturition or delivery, right?
Yeah.
Okay, so there's oxytocin. How would it be controlled?
Using
It's stimulated by suckling.
Okay, so how would you describe the receptor that detects the suckling of the baby? What kind of receptor is it?
Specific.
It is? Well, it
Linda.
depends. It doesn't say specific later on. So what's the baby doing to the nipple that
Well,
the mother's
say
breast
again.
is sensing?
it's suckling.
Suckling.
Yeah.
So is there a suckling receptor?
No.
It's a touch receptor,
Yeah,
right? So it's a
touch.
type of, is it photoreceptor?
No.
Chemoreceptor?
Mechanoreceptor.
Mechanoreceptor, right? And that triggers a reflex
It's always
part that
mechano.
causes the release of
That-
oxytocin, and that gives you milk letdown or milk secretion, right? So on to that other one, antidiuretic hormone.
That's hard.
What's the overall objective of antidiuretic
Well,
hormone?
you're gonna produce less urine.
No, to increase blood pressure.
Right, so it's going to increase blood pressure, and one of the ways it does that is, like you were saying, by reducing urine output, right? How does it reduce urine output?
Doesn't it
Does-
target the kidneys?
Targets the kidneys
Yes.
to make them do what?
Reabsorb more water.
Make
Reabsorb water. Okay? So what would be the trigger for antidiuretic hormone?
Salt.
Not necessarily salt itself.
So
A drop in blood
Blood
pressure,
pressure,
right?
Okay.
Or say dehydration.
Yeah.
Okay.
Okay? Then, doesn't that hormone have another effect
Yes. Constricting smooth muscle.
around?
The vessels.
Okay.
Blood vessels.
So what do we call that effect?
Vasoconstriction.
The suppressor effect, right?
Oh, vasopression.
So at high levels, we get this hormone being secreted cause vasoconstriction, and how does that affect blood pressure?
It's
Makes
gonna
blood pressure
decrease.
go up, right?
Oh,
So,
never mind. Scratch it.
wasn't there another name for that hormone?
Vasopressin.
Vasopressin.
Pressin, yeah.
Okay? Antidiuretic hormone and vasopressin, same thing. Well, it's the same hormone, but to get the pressor effect, you generally have more of the hormone be secreted. So the pressor effect, first of all, antidiuretic hormone, vasopressin, different names for the same hormone. Okay? Then we have two different effects. One is the antidiuretic effect, which is talking about reabsorbing more water. Right? Then we have the pressor effect, which is vasoconstriction to increase blood pressure. Okay, so that's good for the posterior pituitary, right? And then we had the anterior pituitary, and you told me it was also called the adenohypophysis, so not adrenal. Adrenal means adrenal gland, right? Adenohypophysis. It also had another name.
The
Pars
distalis.
Okay. So how will you describe its control?
The hypothalamus, since it releasing kind of hormones for a lot of these because they're tropic.
Okay,
Well,
So we have releasing
CRH.
like CRH, okay. Are they all releasing hormones?
No.
No, so what else do we have from the hypothalamus?
Regulation of something.
Inhibiting hormones, right?
That. Well, that.
Okay, so how do those hormones
Maintaining
get to the anterior
homeostasis.
pituitary?
Isn't it the
The portal
hypophyseal
system.
portal system?
The hypophyseal portal system. So really, how do you describe the linkage between the hypothalamus and the anterior pituitary?
Vascular.
Vascular, right? So you have blood vessels linking the hypothalamus and the anterior pituitary. And I think over there, one of you said it's a hypophyseal portal system, right? What is a portal system?
It's where you have 2 capillary beds instead of 1, like normal. So you would have,
But what about the relationship between those 2 capillary beds?
It's.
What's that for a second? No.
capillary beds. The second capillary bed goes into the
This-
glands.
So what you have to realize is that they are in series, right? So first the blood goes into one, then it goes into a portal vein, and then it goes into another capillary bed, right? All the other capillary beds are in parallel. So you don't have the blood going to one capillary bed and another. They go to capillary beds at the same time. Okay? Do you understand what I'm saying? So let me draw you a picture, because I don't see too many blank looks. Okay, so with a portal system, you have basically an artery. I picked my best pen here today. You have an artery that sends blood
Oh,
to
it's
the
blurry.
capillary bed.
It's blurry. It's real blurry.
Blurry and it's small, right?
Oh,
So your
yeah,
artery
yeah,
sends blood to a capillary bed, and then the blood goes to a vein, and then it goes back to the heart. That's a normal system. But also what you might see is the blood coming from the heart goes through multiple arteries to several capillary beds at the same time, and then back to the vein, and then back to the heart. So this is a parallel arrangement. Okay? But a portal system is in series. So the blood goes to a capillary, then to a portal vein, and then to another capillary, then to another vein, and then back to the heart.
Whoa.
Okay?
Whoa. He lost me.
Does that make sense? So this is a portal. So you go from artery to capillary to a portal vein to a capillary to a vein and back to the heart. This is in series, right? There's a series. One and then the other capillary bed. Here we have parallel where blood from an artery goes to 2 capillary beds at the same time, and then from the capillary beds it goes back to veins and then the heart.
So there's only one way for it to travel, like one's a joy instead of like with the other, it's more like a route, like it just goes in and then you reconnect later. Is there only one? I'm trying to think of the best way to like it. I'm thinking of it less like small, it's more direct, and it just goes from one thing to the other. It's really not explaining it well. Like you can see how the pathway is parallel. That one's direct. It just keeps going from the capillary bed to the capillary bed. There's no other alternative route.
Yeah, there's no alternative route here. Just, if it goes to one, it has to go to the other. That's true. Yeah.
So it's going to 2 capillaries. So it's going from one capillary bed to another one, like back to back.
Right.
Are these
Yeah, because in the hypophyseal portal system, where is the first capillary?
Vessel. Blood vessel.
So where is this first capillary in the hypophyseal portal system? So, let's see, what structure is controlling the anterior pituitary?
Hypothalamus.
The hypothalamus. And you said the hypothalamus was secreting either releasing hormones or inhibiting hormones, right? So the blood first goes to a capillary bed in the hypothalamus where the blood vessels can pick up the inhibitory or releasing hormones. And then the blood goes to a portal vein, which sends the blood through the infundibulum into the anterior pituitary, where we encounter the second capillary bed. And then these inhibiting and releasing hormones diffuse out of that capillary to alter the physiology of the anterior pituitary. And the anterior pituitary may respond to those hormones by, say, secreting some hormone. And then it gets picked up by the blood of the second capillary bed. And then where would it go?
To the rest of the
To
body.
the heart, right? And then it goes everywhere. Does that help out?
Yes.
Good. All right. So, I really should have brought a master pen today, right?
You can borrow mine.
I think we've all got pins.
Some people want me to use their. Maybe this one will work. Let me see. All right. So we're going to go ahead and make a nice table right here. So we have here the anterior pituitary. Okay? Can everyone see that somewhat?
Yes, maybe.
All right. So the anterior pituitary is controlled by what?
The
Hypothalamus.
Hypothalamus. All right. How many anterior pituitary hormones do we have?
We have
6.
Oh, man,
Name one.
growth hormone.
Growth hormone.
Right.
So the abbreviation is
GH.
GH, right?
HGH.
Or HGH.
Lowercase, yeah.
Want to be
The little
really
human.
species-centric. Okay. How is it controlled? By the hypothalamus, but what?
Growth hormone, releasing hormone.
So growth hormone, releasing hormone, and the abbreviation was
GHRH.
GHRH, right? So up from the hypothalamus, we have GHRH that goes down and stimulates growth hormone, right? What else do we have for growth hormone?
GHIH. Inhibiting hormone.
Inhibiting.
Growth hormone inhibiting hormone.
And G, what would that do?
Inhibit growth.
That's going to inhibit growth hormone, right? Now, I also want to mention a couple other names. So growth hormone is given another name too, right? What is it?
A somatotropin.
Somatotropin, right? So growth hormone is also called somatotropin. And then we had another hormone that we talked about is called the somatostatin. What was that?
That's GHIH.
Yeah, so growth hormone inhibiting hormone is also called somatostatin. Okay, so what are the targets of growth hormone?
Liver, bone and muscle,
The
cartilage.
liver, pretty much everything, right?
Yes.
What does growth hormone do to the liver? Not quite.
It stimulates it.
It stimulates it, yeah.
Yes.
So what was the other name for growth hormone again?
Somatotropin.
Which means what?
That it's going to act on another hormone or
Another
another cell to
release
make
hormones,
hormones.
right? And a lot of those hormones are coming from the liver. What were they?
From the liver.
Wait, what? Confused.
And would a hint be inappropriate?
Yes.
So
Always.
they're called the IGS.
Yeah, that didn't help.
IGS. From the
I
liver.
give you an acronym. It's so descriptive. It sticks right out of my mind what it means.
From the liver.
Your mind.
Just shoot in yours because you've been working so hard this semester. So another letter, another word, insulin.
Insulin
Oh,
antagonist.
liver? I
Antagonist.
thought it was the pancreas did insulin.
IGF is insulin something something.
IGF, insulin.
Insulin-like factor. IGF, insulin-like growth factor. IGF, insulin-like growth factor. It's a hormone that the liver and some other cells release in response to growth hormone. Okay? And insulin-like growth factor is the hormone that actually makes you grow.
But that's not like, but it's not,
Huh?
I'm sorry. But that's not insulin. Insulin's in the
It's not
pancreas.
insulin. It's like
It's
insulin. So
like
the
a
structure
similar.
is like insulin. Insulin-like growth factor. Okay? So it kind of does the same thing as, well, it's kind of structurally like insulin. And it causes you to grow.
I do have a question.
Please.
The GHIH, which inhibits, it comes from the hypothalamus and it inhibits growth hormone
Uh-huh.
in the anterior lobe. It's called a somatostatin.
Because it stops the
inhibiting the-
somatotropin.
Okay,
Yeah.
but my question is, why don't you call the GHRH
So,
somatotropin instead of calling the growth hormone itself somatotropin?
because it's
Because the
releasing.
growth hormone is what causes the effect of another hormone. So we normally think
Because
of
this has to
that
occur
as being where the tropin.
before
the
this
tropin
can
hormones
be
are generally released from the anterior pituitary.
Okay,
Okay.
okay. So they don't really call the GHRH somatotropin.
It is
No.
not
Okay.
not called somatotropin.
Okay,
No.
okay.
Don't think that.
Okay, okay.
Because doesn't that have to be activated before the growth hormone can actually act on another hormone?
Yeah, you have to get
Okay.
GHRH and then
Okay. Yeah.
growth hormone and then IgM.
I think that's what you were confused about.
Okay. What else does growth hormone do? So in a kid, it's going to make a kid grow, right? But if I gave growth hormone to any of you, are you going to get taller now?
Because
No, because your physical plates are closed.
Yes.
So what does growth hormone do for all of
Well,
you?
it's going to make our ears and like cartilage
It
grow.
could do that, but what is its real major effect?
Just
Acro-
bone
acromalgia.
still being made.
Oh, so if you have a disease where you produce too much and you're an adult, you have acromegaly. But what is it? What is a normal amount of increased growth hormone do in all of you?
Can it isn't it
In
multiple?
fact, no.
It has to do with calcium?
No.
Is it with blood pressure?
Huh?
Is it with blood pressure because it acts as the
Not so
insulin?
much.
Okay.
Does that have to do with the reproductive organs?
No.
It breaks down fat.
Yeah.
Okay, we can do that. What else?
It's
It
gonna
has to
elevate
blood
blood
glucose.
Ah,
Blood
yeah.
glucose. Elevate.
So blood glucose levels go up. So is it acting like an insulin agonist or antagonist?
antagonist.
Antagonist. Growth hormone is one of the insulin antagonists. Okay?
Why are you saying
All right. So that kind of covers growth hormone.
That's why I have to make. I'm gonna have
Do
to
you have
make
another anterior pituitary hormone you'd like to talk about?
Thyroid stimulating hormone.
Thyroid stimulating hormone. All right.
Yes.
So here we have TSH, right? It's only controlled by stimulatory factors to the hypothalamus, and what is it?
TRH.
TRH. So we had some issues about that particular name in classical times, right?
Yes,
Of course.
more than a couple.
So what does TRH stand for?
Thyrotropion hormone.
Releasing.
Is it thyroid?
Thyrotropion.
Releasing hormone.
Thyroid releasing hormone, right?
That's that part.
Okay. You got to listen closer though this time. It's not thyroid releasing hormone, right? Thyrotropin releasing hormone. So the thyrotropin is what? Thyrotropin releasing hormone says, that name says it's going to cause the release of a thyrotropin, right? The thyrotropin would be
Thyroid
Whatever.
stimulating.
thyroid stimulating hormone, right? Okay.
Yes.
Thyroid stimulating hormone. What's its target organ?
The thyroid gland.
The thyroid. Okay. The target is the thyroid. And it's stimulatory. What does the thyroid make?
The T3 and T4?
Yeah.
T3 and T4. T3 and T4. Which one do you release more of?
T4.
T4.
Oh.
Now what are the main abbreviations T3 and T4 mean?
Oh. Some long words.
Thyro, iota, green.
Good try there.
Wow.
Got iota in there somewhere.
Thyroxine and
Well, thyroxine is one of them. This one is
Tetra
thyroxine.
iota
That's
thyroid.
T4. But then we have, well, what is it?
triiodotonyl.
The iodine.
How much iodine, right?
Oh,
So
yeah, yeah.
T3 is
Only 3.
triiodothyronine,
Oh, that's what
right?
Oh.
T4 is,
Tetra.
Yeah.
but it's tetraiodothyronine, right?
And that's
Tetraiodothyronine. Okay.
What a name.
Yeah. So, wonderful names. What do they do?
well.
They help in metabolism, body metabolism. They
Help in what way? Everything helps
They
metabolism.
breaks down glucose.
Huh?
Breaks down glucose.
I think more specifically, you would say it increases metabolic rate.
Increases
All right.
metabolic rate. Okay.
Okay? Yeah, so when you break down glucose faster, because metabolic rate is higher. Okay, so let's see here. What would cause a release of TRH and then thyroid stimulating hormone and then thyroxine?
Low levels of iodine. Possibly.
No, that would be a
Low levels of
problem.
glu-
So normally what would cause it to go up?
Oh, that would be a goiter, wouldn't it?
Low levels of
Is it
glucose.
body-
Cold temperatures
yeah, body
for
temperature.
infants.
Mm.
Drop in metabolism could do it as well. It's primarily
Pregnancy.
controlled by negative feedback
Can
mechanisms, right?
pregnancy make it go up?
Huh?
Can pregnancy make it go up? Or something?
I haven't ever seen that it does, but it's possible. Okay? And then we also talked about the thyroid hormones having permissive effects.
Mhm.
No,
It's with another
it allows another hormone to work, right? Like,
Yeah.
growth hormone.
like growth hormone, right? How did that permissive effect work? What is
It's like domino effect almost.
She's
Maybe.
like,
Oh, we do have thyroid binding protein, but why does thyroid hormone have a permissive effect? What does it do that allows cells to now respond to growth hormone?
That means it'll regulate
So
growth
what do
too.
you need for a response to a hormone?
Receptor.
The hormones go into the blood, they go everywhere, right?
Receptor.
What determines whether or not it's
Specialized
a
receptors.
Oh,
response?
yeah,
A
that's right.
receptor, right?
Yeah.
So the thyroid hormone allows the cells that respond to growth hormones to start making growth hormone receptors, right? Remember that?
Would you say that one more time?
So the thyroid hormone allows cells that normally should respond to growth hormone to make the receptors for growth hormone. So, what class of hormones do the thyroid hormones belong to?
The amines.
So they're amines, right?
That's what you mean by class? That's what
What
you mean?
chemical class? Yeah,
Okay.
they're amines.
Sometimes I
They're
don't
not
know.
So what
steroids.
can you tell me about them? They're not steroids. They're not made out of
They-
cholesterol, right?
Yes, correct.
They're made from one amino acid. Which one is it?
Yeah,
Tyrosine. So are there any practical implications of that?
What?
There is.
Oh, yeah. The proteins that are in the cell membrane can change the cell membrane. This is a receptor. We're talking about receptors? Are we talking about receptors?
Yeah, it's going to be an implication about the receptor, dealing with the receptor.
That means it has to be.
Yes, this amine can go right through cell membrane, which is why it's stored in a precursor that's found in
Fat.
the column, right? But what about the receptor for the whole thing? Where is the receptor for thyroid hormones? It's an intracellular receptor. What other kinds of hormones have intracellular receptors?
Pancreas.
Class.
Class. Oh.
I mean, it's the peptide ones, the
Steroids, right?
Steroids.
So
steroids.
the
Okay,
amine
proteins and steroids.
thyroxine basically are unusual in that even though they're based off an amino acid, they are like a steroid in that they have an intracellular receptor. Okay? Yeah. Are you feeling crushed?
No.
It is. Just wait till next semester. Okay, what class? Take this one? Okay. Out of pocket. So you're.
I'm an art major, I don't need this.
Okay.
She's an art major.
Oh, my goodness.
They can't believe
funny.
you're not in here.
Anatomical illustrator,
Uh-huh.
and he a minor in biology, I may just change it to.
You know, that sounds like a really good career, and it might be fun, but jobs are really hard to come by.
Oh, I bet.
They really are. Okay, so
Give me a break.
that's TRH, TSH, and the thyroid hormone. I have 6 minutes left.
Okay.
So what I could do is say, do you kind of get the idea of what I'm doing with this table? It's a good way to study. So what we can do is we can continue on with the other say, anterior pituitary hormones, or if you in that range 6 minutes. But I won't even be able to finish it in 6 minutes. But if you have another topic you want to talk about with regards to endocrinology, you can do that too.
That whole, where is that?
The second messenger
It's
system?
the second messenger system, right? CAMP was
The
cyclic AMP,
AMP,
right?
yeah.
So that would be a good topic to talk about.
Yes.
So second messenger, why do we have them?
Well, because they can't go straight through the membrane
What can't go through the
of the
amino
proteins.
acid
I mean, yeah.
protein
Or
the hormone, right?
Yes.
We can't get into the cells, we need some other mechanism. What is another reason for having second messenger system? That's basically what they were saying, right? It's relaying the message inside of the cell. So, let me ask you this. How many, if you have one hormone bind to a receptor, do you just have one molecule changing inside the cell?
no.
You have lots of them, right? What was that called? What did we call that? When you go from one to lots.
Oh, that's the cascade of events.
It's a cascade of events, but that allows us to do something with the signal, to make the signal stronger.
The amplification.
Amplification,
Oh, yes,
right?
yes, yes.
So by using second messenger systems, we can have one hormone bind to a receptor, and we can get thousands of molecules changing in the cell. Okay? So Francesca mentioned that this wonderful cyclic AMP second messenger system. So can you tell me about that? How does that work?
Well, like, okay, so hormone binds to its receptor, and that's gonna cause like the GS to.
Which means,
Oh, what does that mean?
what is GS? The S means stimulatory, right? So it's a stimulatory G protein. It's a peripheral membrane protein. Okay, so we activate that, and what does it do?
That's gonna cause adrenaline cyclase to make cyclic AMP from ATP.
Okay.
And then
And then that moves down in the
Yeah.
cytosol, right?
and that's gonna activate protein
Protein kinases like protein kinase A, right?
Yeah.
That basically are enzymes that cause more things to change inside of the cell. That's cyclic AMP. We have some other second messenger systems too, like
A GMP?
mannitol triphosphate system. How does that one work? Someone else feel like telling me the story just like she did?
No.
You don't need notes. You're ready for the exam already, aren't you? You just laughed.
That's it's gonna burn to its receptor. That's gonna cause DAG.
So, we're going to start, it's a G protein, right?
Yes.
G protein comes from a receptor. So you activate a receptor and activate a G protein. What type of G protein?
GNP.
G sub, not G sub S or G sub I, but G sub
Oh.
Q.
Q.
Then it
What
activates
is that?
an enzyme. What's the enzyme?
That's the
Not adenylate cyclase, but
DHG. Diadenyl. No.
What?
DHG.
I'm really lost.
Page,
I don't know if it's on
page
this.
8, page 8, I don't know.
you know, some of my 2020 class students have actually arrived as well to get ready for their exam, because I have another review for them right now. If you want to help out and tell me, because I'm sure it's right on the top of your heads too, right, this second messenger system stuff, please feel free.
I'm sure it's at the top of your head.
So, what is it? It's not adenylate cyclase, right? That was for cyclic AMP. What is it?
Mm-hmm.
IP3, what does IP3 stand for?
Phospholipase C.
Yeah.
Okay.
Oh,
What does it do?
I underlined it
That's
too.
gonna cause.
Well, it's gonna cause the response
Causes an
of a target cell.
IP to come
Well,
off.
all of this stuff is causing the response, right? But
Well, it's-
phospholipase C being activated is part of the response. What does it do?
The IP3
It creates IP3 from what?
from PI,
PIP2,
P2,
right? So
yeah.
What was PIP2?
a big word.
The DHG. It's a big
IP3 from what?
They didn't even have room to.
What's it
Phospho-
create IP3 from?
Bisphosphate, right?
Yeah.
So phospholipase C cuts phosphoinositol bisphosphate into two things.
yeah.
One was
IP3,
IP3, which was inositol triphosphate.
and then the other was
one was
DAG.
DAG,
Mm-hmm.
which was diacylglycerol. Okay? IP3, what does it do?
It's gonna, yeah.
It increases calcium. How would it do that?
By,
Where do you store calcium in your
Well,
cells?
it's gonna be out
In your bone.
inside.
In your cells, not in your bones.
Okay. Those
Well, it's gonna be the, wouldn't it activate the,
endoplasmic reticulum.
Which type? The
smooth.
smooth endoplasmic reticulum. So it's going to open up calcium ion channels in the smooth endoplasmic reticulum. So calcium comes out of there and it binds to another protein called calmodulin to make calcium calmodulin complexes, and then they activate additional enzymes in the cell. That was what IP3 did, right? What about diacylglycerol?
It's gonna inactivate protein kinase 3.
Inactivate protein kinase 3. So it C. Yeah. So it activates protein kinase
Yeah,
C.
it's been a long day.
Activates, not inactivate.
Well, it's a
C3.
well, some of it.
Yeah, they sound the same, right?
You knew what I was talking about.
But I had to come and look just to make sure there wasn't a problem on my slide. All right. So 10 o'clock. I need to start my review for 2020. If you wish to stay.